Hi there, I'm Sarah. Welcome to Chiropractic Clinic. Today I'm going to go through the initial consultation and what to expect. So before you've even come into the clinic, we will send out a medical history form. We'll send that to your email first, so do check your junk folders just in case it's hiding there, or we can send it via text message. What we want to do is just get as much information about you as possible in terms of things that might help us with the diagnosis and just to give you the best possible treatment. If you don't have access to a computer or a mobile phone, don't worry, because we will go through it again during the treatment process. Once we've collected all the medical history and gone through it again in the room, we will then go through the examination. So we generally do a lot of palpation, we do orthopedic tests, we do neurological tests. We just want to get as much information as possible. I always suggest wearing sort of light, loose fitting clothes, anything you're comfortable in really. Generally we can palpate through the clothes, but every now and then we do need to look at the area, so as long as we can kind of lift up and sort of access that would be most ideal. Once we've done that, we will then go through the diagnosis. So we call it the report of findings. So we go through the diagnosis. Every now and then you might find we go for what's called a differential diagnosis. So sometimes what we'll find is you might not fit one box, you might fit a few categories. So we might say we think it's this diagnosis, but it could be X, Y, and Z. So we're also going to treat for that as well and be mindful of that. If we feel that we need to refer out or get in contact with a GP, we'll let you know as well. And then if you're happy and we're happy, we'll then start treatment. So generally treatment involves joint, muscles and nerve work. Nerve is actually really comfortable. It's usually quite relaxing actually, so we do what's called traction. When I have it done I feel quite sleepy. Muscle work is quite similar to massage. Sometimes we do trigger point therapy, which works really well with joint work. So trigger point therapy, it's just going into the muscles but going quite sort of specifically in to release the area. And then we'll do joint work. So we are classically associated with clicking of bones. We can do that, we don't have to do that. Sometimes it's not warranted, sometimes it is warranted, but even if you don't like bone clicking or anything like that, we don't have to do it. So there are some people that I will never manipulate in that way. Some people will do more like immobilization, sometimes we'll use tools, sometimes we'll just do something else. So I always say we have a plan A, B and C. So if there's anything you don't like or we're not happy with, we've always got an alternative option. And then once we're happy with treatment and once that's all finished, what we'll do is we'll go for a little bit of aftercare. So what to expect, we'll go through exercises, we'll go through what to avoid, what to do, things like that, just to ensure you get the best out of treatment as well. Most common question we get asked is how many sessions, and realistically there is no answer for that. Some people just need the one, some people need a course of sessions. It's completely up to, well, it's completely what you come in with essentially. I hope that helps, and any questions just drop us a message or give us a call.